When you are making the exciting preparations to meet your new baby, most parents are realistic about the fact that there'll be some tears along the way. Crying comes with the territory. But for some, the reality can be a lot more intense. 10 to 30% of all young babies suffer from infant colic, which is an unexplained condition that causes excessive crying in otherwise healthy babies. There is no known cause and few solutions. Being unable to soothe your inconsolable baby can obviously be quite distressing. Aside from being stressful, tiring, and even heartbreaking for parents, infantile colic can be a cost burden to our society in terms of healthcare resources. The good news is that there are some things that you can do to help soothe your baby. There are many studies that have shown that chiropractic care can significantly reduce periods of crying in colicky infants. Let's take a closer look at one of these studies. Conducted in the United Kingdom in 2007, the researchers wanted to find out how effective chiropractic care was for babies who were experiencing unexplained crying. 104 babies, 8 weeks old or younger, were able to participate in this study between October 2007 and November 2009 at a chiropractic teaching clinic. They were randomized into 3 groups. The first group of babies were given chiropractic care, and their parents were aware that this was happening. The second group also received chiropractic care, but their parents didn't know whether their baby was receiving care or the control intervention. And the third group didn't get checked by a chiropractic student. Instead, they received the control intervention, and their parents also didn't know whether their baby was receiving care or the control intervention. Over a 10-day period, the parents completed daily crying diaries, documenting their baby's behavior. The first and second group of babies who were receiving chiropractic care were individually examined and given gentle spinal adjustments where required and as often as needed. If we take a look at this graph, this side is the average change in crying time, measured in hours, and down here we see the number of days, so up to 10 in all. We can see here that the babies who didn't receive chiropractic care still saw a reduction in crying time by about an hour less. But now look at the babies who did receive chiropractic care. They fared significantly better, with up to 3 hours less crying time in some cases. Researchers found that both groups of babies who received chiropractic care responded equally well. We can see here that the babies who did get chiropractic care are crying on average 2 hours less each day after 10 days of care. This is a significant reduction in crying, especially for the potentially frazzled parents. Interestingly, it didn't make a difference whether the parents knew that their baby was receiving chiropractic care or the control intervention. This confirms previous studies that have also shown babies with colic respond well to chiropractic care. It means that the child's improvement is probably due to the chiropractic care itself and not parental bias or the parent placebo effect. This study found that excessively crying babies were at least 5 times as likely to cry significantly less if they received chiropractic care compared to not receiving care. So it's very likely that chiropractic care really does help babies who are suffering from colic. The chiropractic care that was given to these babies in this particular study was also performed by chiropractic students under the supervision of fully qualified chiropractors, and their care had some remarkable results and made a real difference to the families involved. So imagine what a fully qualified and experienced chiropractor could do to help you and your family. As parents, you would have discovered that your child occasionally wet their bed at night. But usually this is something they grow out of by the time they're 5 years old. But for some kids, this does not happen. For some children, this persists, and this is known as nocturnal enuresis. Not only is this frustrating for parents who have to change wet beds night after night, but it can also cause a host of additional problems for the suffering child. Some are devastated by their parents' disapproval, and some are teased by their siblings. Some of these children suffer greatly from low self-esteem that can have a major impact on their mental and emotional well-being. If this wasn't bad enough, many of these children struggle with their social life and miss out on sleepover parties and school camps to avoid other children finding out about their bedwetting problems. So why might chiropractic care help these children? Well, we know that gently adjusting the spine changes the way the brain perceives what's going on in the body. So improving spinal function with chiropractic care may help the brain and central nervous system to notice that the bladder is full and wake the child at night. So what does the research evidence say? Unfortunately, not a lot of research has been done yet in this area, but there are many individual cases published in the scientific literature suggesting that chiropractic care may help at least some children with their bedwetting. And in 1994, a group of researchers performed a clinical trial including 46 children who frequently wet the bed at night. They measured their bedwetting frequency for 2 weeks, and then they divided them into 2 groups. One group received 10 weeks of chiropractic care from final year chiropractic students, and the other group received a sham control intervention. They then measured their bedwetting frequency for another 2 weeks after the 10-week intervention period. So what happened after 10 weeks of chiropractic care? The researchers found that after 10 weeks, the children receiving chiropractic care had on average almost 2 more dry nights over a 2-week period. The kids who did not receive any chiropractic care had no change in the number of nights they wet the bed. This does not sound like much improvement. But when the researchers took a closer look at the results, they found that 25% of the kids who received chiropractic care actually had a 50% or more reduction in wet nights over the course of the trial. None of the control group had this type of improvement. This suggests that chiropractic care may well help at least some kids with their bedwetting, while for others it doesn't help so much. When appropriately applied, chiropractic care for children and infants is very safe and is rarely associated with adverse events. When they do occur, they invariably involve short periods of muscle soreness following an adjustment. Remember that the chiropractor isn't directly trying to treat the bedwetting. Instead, they're trying to improve spinal function with the aim of improving your child's brain's ability to process what's going on in their body. And for some kids, this seems to result in more dry nights and improved bladder control. So if you know of children suffering from bedwetting, share this information with their parents so they can try chiropractic care. We know from this study that at least some kids who wet the bed, chiropractic care really seems to help. So it's worth giving it a go, because it's not just about dry nights, but also about the child's mental and emotional and social well-being. Pregnancy can be a really exciting time for parents as they get ready for their family to grow with baby's arrival. This often means setting up the nursery, shopping for baby clothes, car seats, pushchairs, and lots of nappies. It also means mum's body is changing as baby grows and mum prepares to give birth. Sometimes these changes can be uncomfortable or even painful. In fact, about 3/4 of pregnant mums suffer from pain in their back or pelvis while they are pregnant. This is one reason so many pregnant mums seek chiropractic care to help them through their pregnancy. When deciding whether they should see a chiropractor, pregnant mums often ask, is it safe to get adjusted by a chiropractor when I'm pregnant? The good news is that chiropractors can tailor the care they provide to each individual patient, and the research suggests that chiropractic care during pregnancy is safe for both mum and baby. But what does the research tell us about the benefits of seeing a chiropractor while you're pregnant? When it comes to back pain, not many big studies have been done yet that have looked at whether chiropractic care helps. So although more research is needed, results from the research that has been done so far are promising and seem to show that for some pregnant mums, chiropractic care can be really helpful. In one study, researchers in Switzerland followed 115 pregnant mums for a year who went to see a chiropractor with low back pain. What they found in this study was that over half of the patients said that they improved after just 1 week of chiropractic care, and after a month, that figure had grown to 70%. By the end of the study, about 90% of pregnant mums said their pain was better. From this study, we can't be sure if it was the chiropractic care that really helped them, but at the end of the study, over 85% of the mums said they were happy with the care they received from their chiropractor. One other area that researchers think chiropractic care may help pregnant mums is with the delivery of their baby. For women in labour, the ability to relax and contract her pelvic floor muscles is really important for helping baby to move through the birth canal. Ideally, for the birth process to go as well as possible, giving the greatest chance for a natural vaginal birth, you want strong pelvic floor muscles that can relax and contract at just the right times. In a study conducted in New Zealand, researchers studied pelvic floor muscle function in pregnant women before and after they were adjusted by a chiropractor. What they found was that after the pregnant women were adjusted, their pelvic floor muscles appeared to relax more. This relaxation of their pelvic floor muscles after they were adjusted may mean that chiropractic care could help them to have a natural vaginal delivery. This was only a small trial, and the researchers couldn't be sure how much of an impact these relaxed muscles would have on labour itself. But it does suggest that for pregnant mums, chiropractic care may give them some control over their pelvic floor muscles, which may make childbirth easier. Other research supports this idea, with one study reporting that new mums experience on average a 25% reduction in the length of labour time with chiropractic care during pregnancy, and that rises to a 31% reduction for mothers who have given birth before. It makes sense to keep yourself as healthy as possible during your pregnancy. So if you want help with the way your spine and nervous system are functioning, consider seeing your family chiropractor, because it's natural, safe, and may help you to feel better and boost your chances of having a faster, easier delivery of your little bundle of joy. One question many new parents ask is whether they should take their baby to see a chiropractor or another manual therapist. But babies don't have back pain, do they? So why might a chiropractor help a baby? Well, the answer is really simple. Chiropractors don't see babies to help them with their back pain. They see babies to help improve spinal function, with the aim of improving your child's brain's ability to process what's going on in their body and give them the best possible start in life. But why might a baby have problems with the way their spine is functioning? That's another really simple question to answer. Spending 9 months growing in mum's tummy can get really cramped. Before baby is even born, the pressure they're under in the mum's uterus can cause changes in the way their bones move and fuse together, or the shape of their skull. And then the strains the baby faces during delivery, either as they pass through the birth canal or from forceps or other forms of assisted delivery, can cause injuries to the baby's spine or nervous system that doctors and parents may not even be aware of. In fact, a study was published in 2015 where researchers looked at 100 healthy newborn babies and tested them for a variety of problems with the way their spine and the bones of their skull were moving. What the researchers found in this study was that just about all the babies they checked had a problem that may have benefited from care by a manual therapist. Over 90% of the babies had a problem with the way their neck was moving, and even more had problems with their lower back. That was a really interesting finding because who knows? Maybe babies get pain after all. The researchers in this study were also interested to see whether the duration of labour made a difference to how many problems the babies had with the way their spine and skull moved. What they found was that the longer labour went on for, the more problems the babies had. These problems are all types of things that chiropractors and other manual therapists aim to help with when they check your baby. And this may explain why research studies have suggested chiropractic care may help babies to cry less and maybe even sleep better. When appropriately applied, chiropractic is known to be safe for kids and babies. So maybe it's a good idea to have your baby checked by a chiropractor, especially if they had a long or difficult birth, to make sure they get the best possible start in life. For many mums and babies, breastfeeding can be a real challenge. We know that about 80 to 90% of mums try to breastfeed at birth, but by 1 week of age, as few as half of mums are still exclusively breastfeeding. This figure continues to drop, with only about 1% of mums exclusively breastfeeding when baby is 6 months old, which is the recommended time we should exclusively breastfeed for. There are, of course, lots of reasons why mums give up on breastfeeding, from sore nipples to inadequate milk supply or baby having issues with latching or suckling. All too often, these problems lead to too much pain or even breast infection, and ultimately, and understandably, mum giving up on breastfeeding because it just gets too hard. This is a real shame because we know that breastfeeding is really important for babies' health. We know that babies who are breastfed are less likely to suffer from ear infections and tummy bugs. They're even less likely to develop asthma and other conditions that can be life-threatening. It just goes without saying that nature knows best and that breastfeeding is the optimal form of nutrition for infants. So if someone is having issues with breastfeeding, what can they do about it? Luckily, help is available. Lactation consultants and other health professionals can really help mums and babies to overcome the breastfeeding issues. And one healthcare profession that many new mums turn to for help is their family chiropractor. But why might a chiropractor help with breastfeeding? Well, the answer is really simple. Chiropractors see babies to help improve the way their body and nervous system functions so that they can get the best possible start in life. But why might a baby have problems with the way they move or function? That's another simple question to answer. Spending 9 months rowing in mum's tummy can be really cramped. Before baby is even born, the pressure they're under in mum's uterus can cause changes to the way their bones move and fuse together, or the shape of their skull. And then the strains baby faces during delivery, either as they pass through the birth canal or from forceps or other forms of assisted delivery, can cause injuries to baby spines or nervous systems and other joints that doctors and parents may not be even aware of. We know that successful breastfeeding relies on lots of complex movements that involve the spine and jaw. And we know that babies with breastfeeding problems often have imbalances in the way their spine and jaw is working. We also know that chiropractic care has a positive impact on the way our spine and jaw works. So it's possible that chiropractic care may help with breastfeeding problems. So what does the research tell us about whether chiropractic care can help mums and bubs who are struggling with breastfeeding? At this stage, large, costly clinical trials haven't been done to really study how much chiropractic care can help, so we can't say for sure how effective it is. But what the research that has been done does tell us is that many mums who take their babies to chiropractors because they're struggling with breastfeeding report really good changes after their baby is adjusted. In one study that was conducted in the UK, the researchers followed 114 mums and babies who presented to a chiropractic teaching clinic for care. All the babies were under the age of 12 weeks, and they were all unable to breastfeed exclusively. The babies were seen by the chiropractic students up to 9 times, and the student used low-force chiropractic techniques to release tension and improve muscular imbalances. The researchers were most interested in whether mum and baby would be able to breastfeed exclusively after they received chiropractic care. But they also looked at mum's rating of overall improvement and baby's weight gain. What they found was that all of the children showed some improvement, with over 3/4 of them being able to exclusively breastfeed after just 2 to 5 chiropractic visits over a 2-week period. From a study like this, we don't know how much the placebo effect was involved. And with care provided by chiropractic students, we don't know if the results would have been even better if an experienced chiropractor provided the care. But what we do know from a study like this is that it suggests that for some babies with breastfeeding problems, chiropractic care really may help mum and baby to breastfeed exclusively, which is a great thing for mum and baby alike. We also know from other research that when appropriately applied, chiropractic is known to be safe for kids and babies. So if you're having trouble with breastfeeding, it's a good idea to have your baby checked by a chiropractor to make sure they get the best possible start in life. Spending 9 months growing in mum's tummy can get really cramped. Before baby is even born, the pressure they're under in mum's uterus can cause changes in the way their bones move and fuse together and can influence the shape of their skull. And then the strains baby faces during delivery, either as they pass through the birth canal or from forceps or other forms of assisted delivery, can cause injuries to baby's spines and nervous systems that doctors and parents may not be aware of. Then, once baby is born, they may have many tumbles and falls as they learn to sit, stand, crawl and walk. And as they grow, they take knocks on sports fields and they fall from jungle gyms. When you put all of this together, your baby or child can end up with problems in their spine that chiropractors call vertebral subluxations or chiropractic subluxations. One study that was published in 2015, researchers looked at 100 healthy newborn babies and tested them for a variety of problems with the way their spines and bones of their skull were moving. What the researchers found in this study was that just about all the babies they checked had a problem that may have benefited from care by a manual therapist, such as a chiropractor. Over 90% of the babies had a problem with the way their neck was moving, and even more had a problem in their lower back. But as a parent, what can you do about this? One option to consider is to take your baby or child to see a chiropractor so that they can ensure that their spine is in tip-top shape. Thousands of parents choose to do this every single day. Recently, the Victorian government in Australia held an inquiry into chiropractic care for babies and children, and they asked parents in Australia to let them know about their experiences when they took their child to a chiropractor. This is what the inquiry found. Almost 22,000 parents responded to the inquiry and told the Australian government that they had taken their child to see a chiropractor. And 99.7% of these parents reported a positive experience with the chiropractic care of their children. These parents had accessed chiropractic care for their child for a wide range of conditions and complaints, including maintaining general health and well-being. The most common conditions included postural concerns, or colic, or neck pain, or difficulty with breastfeeding, or back pain and headaches. And the overwhelming majority of parents reported that chiropractic care helped their child, with 98% of these parents indicating that their child improved after seeing the chiropractor. But what about the safety of chiropractic care for kids and babies? A question chiropractors are often asked is whether chiropractic care is safe for children and babies. This inquiry in Victoria had a very big focus on safety, and what they found was that through their extensive search, they identified very little evidence of patient harm occurring in Australia. In particular, there was no patient complaints or practitioner notifications that arose from significant harm to a child following spinal manipulation. This is backed up by research studies that have also found that chiropractic care for children and infants is very safe and rarely associated with adverse events. These studies have found that when an adverse event relating to chiropractic care for children or babies is reported, they tend to be very short periods of muscle soreness after an adjustment that goes away by itself. So the research evidence is clear that when a thorough history and exam is taken and appropriate techniques are chosen, parents can be confident that their child truly is in safe hands with their chiropractor. So make sure your child's spine is in tip-top shape and give them the best possible start in life by taking them to see your family chiropractor. We've all heard of growing pains, right? But did you know that what we call growing pains aren't associated with growing? So they're not actually growing pains at all. This has led doctors to start calling growing pains different names, like benign nocturnal limb pain of childhood, which really just means that your child has sore arms and legs at night, and they don't know why, but they don't think it's a major problem. We actually know very little about growing pains, apart from that some children get sore arms and legs at the end of the day and they usually wake up feeling better in the morning. Unfortunately, there's no easy test to tell a doctor whether these pains are something that will go away by themselves or whether they're actually due to a very real problem that your child needs help with. We now know that if your child suffers from pain, you shouldn't just assume that they will grow out of it. Studies have shown that when children develop pain like neck pain and back pain when they're young, which is also surprisingly common, they very often get worse over time, with the pain becoming chronic, more intense, spreading to different locations, and becoming much more frequent as they get older. By the time children turn 18, they have the same amount of back pain as adults, which is a real problem, because low back pain is the leading cause of disability around the world. It's probably not too surprising that our children are experiencing more pain, like back pain and headaches, than ever before, because we know that pain in kids is associated with low levels of physical activity, and our kids are less active now than they ever were before. One reason for this inactivity is that many children now spend between 5 to 7 hours a day on their smartphones or handheld devices. This is causing the 21st century epidemic called text neck or tech neck that comes from hours of bending forward to look at devices. Text neck or tech neck results in changes in the bones, ligaments and muscles that support the head and causes postural changes and pain in the neck and other related areas. It can even cause eye problems and problems with breathing and circulation. So our kids are right now taking part in a worldwide experiment to see just how much their health will suffer because of the modern lifestyle that we're currently leading. Parents need to be aware of this major public health problem and be proactive about the choices they make to help their children. The best place for parents to start is by limiting screen time and encouraging physical activity. Parents should also make sure that they don't assume that if their child is in pain, that it will go away by itself. Parents should consider taking their children to see a chiropractor to make sure that their spine and nervous system are working well and aren't under too much stress because of their device use or lifestyle choices, because chiropractic care really can help. An example of this comes from a recent research study that looked at the benefits of chiropractic care for kids with recurrent headaches. Headaches in children are very common. It is a real problem because they can interfere with school performance, social activities, and sports. And kids with frequent headaches suffer from higher levels of stress and depression. Just like so many other types of pain, kids who suffer from headaches often go on to become adults who suffer with severe headache syndromes. Many things can cause headaches in children, from poor food choices through to trauma on the sports field or playground. But one other very important cause of headaches in kids is prolonged static postures, which is a very scientific way of describing text neck or tech neck. A group of researchers wanted to find out whether chiropractic care might help break the headache cycle in kids with recurrent headaches. So they did a study with almost 200 kids, aged between 7 and 14, who suffered from at least one headache a week. They split the kids up to either receive chiropractic care for 4 months or fake chiropractic care for 4 months. And they tracked them to see if there were any differences in how many headaches they experienced over the 4 months that they were in the study. What they found was that the kids in the chiropractic group had significantly fewer headaches than the kids in the control group, and they felt a lot better too. Almost half of the kids in the chiropractic group reported that their headaches had improved during the study, which is a really good result for those children. This study shows one example of how chiropractic care can help interrupt the pain cycle in children, which is really important because we know that kids who are in pain very often become adults who are in pain. Your brain basically learns to be in pain. Because remember that chiropractic care isn't just about treating pain. Chiropractic care is all about improving the communication between your brain and your body so you can function at your optimal potential. It's also good to know that chiropractic care is safe for kids and babies. So make sure your child's spine and nervous system are in great shape by taking them to see your family chiropractor and give them the best possible start in life. It can be heartbreaking when your child is suffering from an ear infection, crying distressed with pain, pulling on their ears, unable to settle or sleep. As a parent, you may be left feeling helpless, not knowing what to do or how to comfort your child. Let's explore what ear infections are and what you can do if your child is suffering from earache. Ear infections can come on quickly and last just a few days, or they can be chronic and last for weeks or months. We usually call an ear infection that comes on quickly an earache, and doctors call it acute otitis media. Infections like this are most frequent in children under 2 years old, and they are one of the most common reasons that parents take their child to see a doctor. Ear infections that last for a long time are more common in kids who are a little older, and these infections are often called glue ear or otitis media with effusion. Earache and glue ear are usually caused by a viral or bacterial infection deep inside the ear. It wasn't that long ago that doctors routinely prescribed antibiotics to kids and babies with an ear infection. More recently, though, experts have warned against routine antibiotic use because it doesn't usually help very much, and the side effects of antibiotic medication often outweigh the benefits. These days, the most common medical approach to otitis media is to provide pain relief and a wait-and-see approach to let your child's own immune system deal with the infection. This is because about 80% of children with earache get better on their own within a few days. And if it doesn't get better on its own, there are a number of medical treatments that may be of some use, but scientists still question whether or not they're effective. One of the traditional common treatments for chronic ear infections that won't go away by themselves is to insert grommets or ventilation tubes in the ear. Unfortunately, current research tells us that in many cases of chronic ear infections, grommets don't work all that well. This brings many parents back to having to follow a watch-and-wait approach, and this can be very frustrating, especially if your child's in pain, or if your child has glue ear and is suffering from temporary hearing loss, which can affect their education and their development. This is why many parents look for alternative options to help their child with ear infections. One place parents may look is to manual therapists, like chiropractors, because many people believe that it can help at least some children with ear infections. But what does the research tell us about chiropractic and ear infections? Researchers have looked into whether chiropractic care or osteopathic care may help children with ear infections because they think it may help with their immune response or that it may help to drain the tubes that are blocked or infected by changing the way that their cranial bones or the top of their neck bones or their muscles around the top of their neck are impacting on these blocked tubes. One researcher reviewed almost 50 different research articles that had looked at whether chiropractic care or osteopathy could help ear infections. What they found was that many of these studies came from a single patient or a small number of patients with earache who got better. But there were no control groups in these studies, so it's impossible to tell if these children would have improved by themselves even if they hadn't gone to see a chiropractor or an osteopath. In this review, the researchers did find some higher quality randomized controlled trials, which have some promising but mixed results. One of these studies involved osteopathic care, and it didn't show any real benefit in preventing earaches in children who are prone to getting them. But another osteopathic study was more positive and found that osteopathic care was beneficial for kids with recurring acute ear infections. In this study, they included 57 children, aged 6 months to 6 years old, who suffered from recurring earaches. One group received usual medical care from their pediatrician, and the other group received the same usual medical care as well as care from an osteopath. They followed these kids for 6 months and found that the group receiving osteopathic care had fewer episodes of earache throughout the study period compared to the group that didn't see the osteopath. They also had fewer antibiotic prescriptions and fewer grommet surgeries. So there were some really good results in this trial for children suffering from recurring bouts of earache. But keep in mind that researchers always want to have a number of good quality studies that report consistent good results before they're convinced that an intervention works. And that means that when they look at all the research that's available about chiropractic and osteopathy and earache, researchers tend to say that although it may help, they can't tell for sure until we have more good quality studies completed. So what does this mean for you if your child is suffering with ear infections? Well, you should know that for some kids with recurrent earache or glue ear, they really may benefit from having their spine checked by a chiropractor or another manual therapist like an osteopath. Although a lot more research needs to be done before we fully understand how well chiropractic care can help these kids, we do know from many other researched studies that chiropractic care for children and infants is very safe. So if you're not happy with taking the wait and see approach, or you're looking for a safe natural intervention when it comes to your child's health and well-being, well then take them to see your family chiropractor and make sure their spine and nervous system are in tip-top shape to give them the best possible start in life.